All right, so I'm back home. I saw the patient that I was talking about earlier in my quick video earlier. This is a lady with secondary lymphedema from the past, and her lymphedema has been managed. Her weight has also been managed. Apparently, with the excess weight that she had before, her joints, specifically her left knee joint cartilage, are diminishing. So her orthopedic doctor has been seeing her doing. Okay, so let me share to you guys this article by Joshua Kolz, William Rayner, and this is in a PubMed.gov article. This is a significant risk of factor for infection and implant failure after total knee arthroplasty. So this is just an article that has been researched by this group of people that did the research on this. All right, so let me see. They said that lymphedema is characterized. Yeah, we know that lymphedema is a fluid buildup and swelling leading to skin fibrosis and recurring soft tissue infection. So we know even before surgery, even before we do any replacement surgeries, that the lymphedematous area or leg is already prone to recurring skin soft tissue infections. So in this study, the purpose of this study was to review the outcomes of total knee arthroplasty or a replacement, total knee replacement in patients with lymphedema compared to a matched cohort with primary osteoarthritis, so people with no lymphedema. And the result of the study showed that lymphedema increased revision hazard ratio, reoperation, and infection, in addition to periprosthetic fracture and tibial component loosening. In the mean time to infection trended towards later time points in knees with lymphedema. So it says 2 months, like 19 days to 2 months, 19 weeks or 2 months. I'm not so sure about that. But anyhow, lymphedema increased the risk of revision, reoperation, and infection. It's just because we know that having the lymphedematous leg or extremity, we are already, number one, prone to getting a recurring infection of the soft tissue. That's why it is very risky to have a replacement surgery or any kind of surgery on the joint, on the area where the lymphedema is. However, you have to weigh the pros and cons. So if you want to get rid of the pain because you have the pain of the arthritis is too much and you can't function, and then your lymphedema or your edema is not going down anymore, you cannot do anything anymore, then you might as well, do the surgery. Okay. So this is if you want to read more on this article, I'll put the link down on the description box so that you can read more about it. So anyhow, the lady that I had today, earlier this afternoon, she already lost a lot of weight because her doctor told her that you will have a good result if you try to lose some more weight before we do the surgery, because we know for a fact that if you have a heavier leg or a heavier body, like the prosthesis might not be able to sustain you, or your infection is number one is for the infection to recur on your soft tissue. So we'll try to lose some weight. So she did lose some weight, and now she had the surgery done. And on her first day, she did very well, and she was still not in a whole lot of pain because she is still on nerve block. In my experience lately, the nerve block usually diminishes, or the whatever medication they put on your extremity where they did a surgery, the drug diminishes in its function by 1 week or by 5 to 7 days. Now it depends on the patient, it depends on the pain tolerance. So then by that time, you can take your regular pain medication that the doctor gave you in order for you to, be able to sustain the pain while you're doing your rehabilitation. So just like any other total knee replacement surgery, the most important goal is to be able to function, to get the full function of the knee, as much as you can, and of course to get rid of the pain. Now, the pain that you have at this time is not the pain from the osteoarthritis, because there's no more osteoarthritis. So you already took away the old joint and replace it with a new one, which is a prosthetic one. There should be no pain anymore. However, the pain that you will have is because of the surgery or the incision. However the doctor did the surgery, is just from cutting or whatever they did. It's a temporary pain. So once the wound is healed, once the surgical wound is healed, then you'll be okay. Now, in my case, in my experience, most of my clients will always have pain on and off for at least a year. Now, some of them, they just boom, get better soon. So it really depends. It depends on your tolerance of the pain. It depends on how much you do your exercise or your plan of care for your rehabilitation. And it depends on your motivation to do it, that you have a goal that you want to be able to function better in the future or in the near future. That way you can resume your normal activities without pain or with less or no pain. We want no pain if we can. Now, for the edema part, if you have lymphedema, the edema is doubled up, okay? But it doesn't mean that you will really have a bad, that your swelling will be more than the usual that you had. You are still going to expect that you will go back to the size, the volume, or the size of your limb that had the replacement, to go back to the operative size. So meaning, if you have a +1 or a +2, or however you want to measure your leg, say if you have a +1 before the surgery, you would expect to have a +1 after your rehabilitation. It might take a while, or it might be quicker. It depends on how well your soft tissue or your joint will respond to the treatment. So what kind of treatment are you going to have? You're going to have physical therapy. It's going to compose of pain management so that you can do your exercise. It's going to compose of range of motion exercise, getting that knee to bend and getting that knee to straighten out. And then of course you have to have the functional mobility, which is very important. You have to get up out of bed, standing activities, walking if you can, as much as you can tolerate, so that you'll be able to resume your normal activities in the near future. So those are some of the important things that you would consider in, if you have a lymphedema and you're want to have replacement surgery, because that's the one of the last option to get rid of your osteoarthritis. So I hope you guys got anything from this. And if you have any questions, once again, I want you to try to, comment down in the comment box below, because I really want to know. I want to help you guys however I can help you in my own ways. I've been doing lymphedema therapy for a while now. I would say since 2013. I started doing it in the skilled nursing facility, and then I went into the outpatient, and now I'm more on the home health side. So different settings. In the home health side, it's different settings, but the same type of treatment. You just have to modify how you're gonna approach your rehabilitation. So thank you for watching. I hope you get something from this. And well, as I've said, every time I get some other kind of medical condition related to lymphedema or physical therapy, I'll try to come in here and share with you guys what you can do about the condition and just anything. Thank you again. Thank you for watching. I don't know how many times I've said thank you for watching. And you have a great day. Be blessed. And remember, God is good, and He is there always to help us with whatever things we need. And remember, health is wealth. Prevention is the best medication. So before your condition gets bad, go see your doctor, go see your physical therapist, or go see your lymphedema therapist. Thank you. Bye-bye.